Yeah, so another important update that we provided from the GRIFFIN trial in conjunction with our good colleagues that are spearheading the MASTER initiative, which was basically looking at daratumumab with carfilzomib, lenalidomide, and dexamethasone in newly diagnosed myeloma patients. We joined forces to better understand the stem cell mobilization issues, when you add a CD38 antibody to an IMiD-based induction platform. What was seen in the CASSIOPEIA trial, so this was the phase 3 trial that looked at bortezomib, thalidomide, and dexamethasone with or without daratumumab. What they saw in that particular trial was that the median stem cell yields was lower in the quadruplet arm versus the triplet arm, and there was a higher rate of utilization of plerixafor in addition to GCSF to mobilize those stem cells. We saw the very same thing in the GRIFFIN trial as well, so a higher rate of utilization of plerixafor for those patients getting the quad versus the triplet. Now in the MASTER trial, patients routinely got GCSF and plerixafor right from the beginning, so we can't really say much about that, but that there's no question, that adding a CD38 antibody to an IMiD-based induction platform does have a statistically significant impact on stem cell yield. Now, in the overwhelming majority of cases, importantly, it's not clinically significant. So in the vast majority of cases, both in the MASTER trial and the GRIFFIN trial, investigators were able to collect the number of stem cells that they had intended to collect for at least 2 transplants. So that's very encouraging. And I think it's going to be incredibly important, to look at this in other studies as well, because the duration of initial treatment varies quite a bit, and what impact will that have on stem cell mobilization. One thing that I will say, though, is that, for providers that are looking to transplant their patients after, say, a dara-RVd-based induction strategy, probably give yourself at least 4 weeks from the end of therapy to the time of collection. And then the other thing is to make sure that you get your patient scheduled for 2 days of apheresis for those stem cells rather than just 1.